First, I'd like to briefly introduce oxidative stress. The source of oxidative stress is reactive oxygen species, or ROS, and free radicals, which are constantly produced during our life activities. A small amount of ROS is essential for maintaining homeostasis, but an excessive ROS can lead to cellular inflammation. There are antioxidants such as vitamins, glutathions, and enzymes such as superoxide dismutase in the body. Antioxidants counteract the constantly produced ROS and free radicals to maintain the balance. It is known that such ROS and free radicals increase due to aging, chronic diseases, lifestyle, and the surrounding environment. These factors cause an excess of ROS and free radicals or a weakening of our antioxidant capacity, resulting in an imbalance. This state is called oxidative stress. Excessive amount of ROS and free radicals is said to be the cause of more than 150 diseases. In this presentation, I'd like to focus on allergic disease. Allergy is now one of the most familiar diseases. Allergy refers to a condition in which the immune system, which protects the body from foreign substances, overreacts to specific substances or allergen, resulting in symptoms in the body. Allergens include pollen, certain foods and chemicals, etc. Examples of allergic diseases include bronchial asthma, allergic rhinitis, atopic dermatitis, food and drug allergies, and anaphylactic shock, etc., all of which we have all heard of. Among these allergic diseases, hay fever, atopic dermatitis, and asthma are particularly familiar. Hay fever, also called seasonal allergic rhinitis, is an immune response to pollen from plants such as cedar that enters the nasal cavity, causing runny nose and other symptoms. The main pollens that cause the disease vary greatly from region to region. In Europe, the main pollens are the Poaceae family. In the United States, ragweed, etc. And in Australia, acacia is famous. In Japan, cedar pollen is the overwhelmingly majority. In 2012, 7% of adults and 9% of children are diagnosed with hay fever in the past 12 months. In Japan, hay fever caused by cedar and cypress pollen is very serious. According to a national survey, the frequency of hay fever is 40% of the population, while 1 out of every 2 people in Japan has hay fever. Next is atopic dermatitis, another very popular allergic disease. It is a disease in which the skin barrier function is impaired, causing the skin to react to various stimuli resulting in inflammation. Patients with atopic dermatitis also tend to have dry skin, as moisture is easily lost from the skin. The main symptoms are eczema, skin redness, skin lesion, dry skin, scabs, and intense itching. In particular, itching damages the skin, which further reduces the barrier function, creating a vicious cycle. Atopic dermatitis is found in 4.9% of adults in the United States and 2.1% of adults in Japan. Atopic dermatitis is also found in about 12% of children between the ages of 4 months and 6 years, and in about 9% of children in their 20s and 30s. The prevalence in children is as high as 20% in some countries like Sweden. And asthma is the most life-threatening of these diseases. Asthma is a disease in which inflammation of the airway causes symptoms such as cough, phlegm, breathlessness, wheezing, and chest tightness. Normally, the airways, especially the bronchi, are made up of mucosa, submucosal tissue, and smooth muscle. In asthma patients, inflammation occurs in these airways, causing reddening, phlegm accumulation, and narrowing of the airways. When the airways are stimulated in any way, they become even narrower, resulting in the aforementioned symptoms. Asthma affects 262 million people worldwide and kills more than 450,000. In the United States, asthma affects 1 out of every 12 people, and in Japan, it is estimated that about 8 million people in the entire population are affected. There are already many allergic patients around the world, and the number continues to grow each year. The following figure explains mechanism of allergy. The allergen causing the allergy is recognized by the immune system as a foreign substance, and under the command of Th lymphocytes, IgE antibodies that react with the allergen are mass-produced and bind to the surface of mast cells. In addition, inflammatory cells such as eosinophils gather and prepare to react whenever the allergen enters the body area. This state is called sensitization. When the allergen re-enters the body, these inflammatory cells release a large amount of inflammatory substances, causing inflammation and the appearance of diseases. To prevent these allergies, the principle is to identify the causative allergen and avoid contact with it. However, in case of allergens that cannot be avoided, such as pollen, you have to take medication for prevention and symptomatic treatment. Therefore, there has long been a demand for treatment option that is simpler than pharmaceuticals. Many studies have demonstrated that oxidative stress is closely related to these allergic diseases. Currently, PubMed has over 3,800 references on allergy and oxidative stress, and the number is increasing every year. Here are examples of the literature. In the review of oxidative stress and allergic respiratory diseases, multiple investigators have shown that increase in ROS that occur during asthma is associated with extensive biomolecular damage in the lungs. Outside of asthma, the role of oxidative stress in allergic rhinitis is also described as possibly similar to that in asthma, and decreased blood level of vitamin E, catalase, and glutathione peroxidase has been observed in allergic skin diseases. In allergic skin diseases, the skin is exposed to endogenous and environmental pro-oxidant agents, leading to the harmful generation of ROS. The resulting oxidative stress damages protein, lipids, and DNA. In non-asthmatic seasonal allergic rhinitis, exposure to natural allergen induces oxidative stress and airway inflammation in patients. And nasal steroid therapy may play a role in moderating oxidative stress. Thus, allergic diseases are oxidative stress diseases, and there's a possibility that above diseases can be prevented or treated by antioxidant therapy. (20X) combination shown on this slide is an antioxidant supplement developed by Professor Intl of our division. The active ingredients, as shown here, consist of 8 vitamins and amino acids. Previous study has proven that it has high antioxidant activity, and although it is a dietary supplement, it has passed drug level safety tests and has been proven to have no side effects. As an example of 20X effectiveness, the result of this out-center randomized, double-blind, and placebo-controlled prospective interventional study have certified that 20X is effective in preventing dementia, one of the oxidative stress diseases. From here, I would like to report the result of a questionnaire survey conducted on humans. Participants suffering from the typical allergic diseases mentioned earlier were recruited via the internet, asked to take 20X for a certain period of time, and to evaluate by self-report whether the allergic symptoms had improved. All of the following survey were commissioned to eyes incorporation. First, hay fever. There were 102 participants ranging in age from 20s to over 50s who were all females. All participants were asked to take 20X for 8 weeks, and how the symptom changed after taking 20X was surveyed. As a result, when asked how much hay fever symptoms appeared after taking 20X, 20% of the participants answered that they hardly experienced any symptoms. Furthermore, including those who experienced milder symptoms than usual, 90% of the participants showed improvement in their symptoms with 20X. Moreover, while oral medicine and nasal and eye drops are often used to treat hay fever, we asked whether the use of these medicines has changed after taking 20X. The results show that 20% of participants no longer need medication. In addition, 50% of the participants decreased the amount of medication. We surveyed what specific symptoms shows improvement. The following symptoms were listed: runny nose, itchy nose, tearing, itchy eyes, sore throat, and itchy red skin on the face. For these symptoms, we summarized the percentage of participants who reported particularly significant improvement. More than 80% of participants reported significant improvement in the symptoms of itchy eyes and runny nose, and more than 50% reported improvement in sneezing and itchy nose, and a certain number of participants reported improvement in other symptoms as well. The study shows that 20X improved a wide range of hay fever symptoms. Next, a similar survey was conducted on atopic dermatitis. Participants were recruited from those 50 years of age and older who had been diagnosed with atopic dermatitis. We had 68 participants, mostly females, in their 20s to 50s and older. Participants were asked to take 20X for 4 weeks. Here is a survey of the impact of eczema caused by atopy on daily life. This pie chart asked how many days per week the skin was itchy. At the 2 weeks of 20X intake, 2/3 of the participants were itching 4 to 7 days per week, or more than half of the week. At 4 weeks of 20X intake, however, those participants decreased to 1/3, and number of days with little or no itching had increased. This is about the number of the days that sleep was disturbed by eczema. The number of days when sleep was not disturbed by eczema increased by 1.5 times after 4 weeks of treatment with 20X. Looking also at number of days that skin cracking due to eczema occurred, the number of those who had skin cracking every day decreased to half after 20X, and 0 day was increased. And regarding the dryness caused by eczema, 2/3 of the patients were suffering from eczema 7 days a week. After 4 weeks, however, the dryness was greatly improved and reduced to 1/3. And when asked the question, overall, was 20X effective for atopic dermatitis? Nearly 80% of the participants responded yes. We found that 20X improves the symptoms of atopic dermatitis patients. Lastly, we present data on asthma. 44 women who had had an asthma attack within the past 4 months were asked to take 20X for 4 months. The results show that 2/3 of the patients had 4 or more attacks in the 4 months prior to take 20X. After 4 months, the number of patients who had 4 or more attacks decreased to 1/3. In particular, those who had 11 or more attacks decreased by 1/3, and 16% of those who had never had an attack. 20X was shown to have the potential to reduce the number of attacks in asthma patients. Furthermore, participants were asked to freely list any other improvement they had experienced since taking 20X. Here is a part of the list. In addition to comments such as no asthma at all and less frequent use of nasal drops, there are also many comments reporting improvements such as reduced allergy symptoms in general, improved constipation, improved skin, fewer colds, and better mood. In particular, several people reported improved morning wakefulness, skin condition, and less chance of catching a cold. Since high levels of oxidative stress can impair sleep, skin, and body immunity, the results suggest that antioxidant potential of 20X may have improved all of these factors at once. Here is the conclusion. Allergic disease patients are increasing, and they are known to be oxidative stress diseases. Antioxidant combination supplement 20X has shown efficacy against typical allergic diseases, hay fever, atopic dermatitis, and asthma. And the use of medication was reduced by alleviating symptoms. The results suggested that 20X can contribute to the future treatment of allergies as well as to the reduction of healthcare costs by reducing oxidative stress. That is all. Thank you very much for your attention.